respected seniors, dear Foxians, and countrymen. Today, I'm really so happy to present in front of you as a 175th episode of Successful Gyan Pravah. My dear friends, it's really give me an immense pleasure that we have come out with this and it is so successful. And every day, everywhere we are getting, the positive response from the every strata of the country, from medicos, from non-medicos. My dear friends, I just want to tell you that this Gyan Prabha is a brainchild of none other than but our dynamic president, Dr. Sunita Tandulwadkar, madam. Madam is a president Foxy. Madam is a past president IG. Ma'am is a president elect of ISAR and what not. Ma'am is a past president of Pune Obvious Society. And I, ma'am, please let me finish. I always, believe that ma'am is the one who have the first stem cell baby in India and first at a age of 45 year in the world. So, ma'am, your whole, journey is an inspiration to all of us, to all of us. So, thank you so much, ma'am, for
Thank you,
always being there, for
Apurva.
always with us. Over to you, ma'am, Hannah, for your kind blessing and to
Thank you.
start today's
Thank you,
podcast.
Apurva. It is such a wonderful feeling of 175th Gyan Pravaha podcast. I can't believe when we imagined that 30 committee chairperson, Hema Bandhu, what is our this Gyan Pravaha podcast is from 29 January. We started it because February has only 28 days. We would have missed on those who are 29, 30th, and 31st. So we started, every chairperson has been given a date. So today is the 24th July, Apurva. What is the
22nd July.
22nd? I've lost the days and I just work.
I know,
I
ma'am.
don't know that
Absolutely.
सुबह क्या है शाम क्या है. I'm just
Sham ko kya
working either for Foxy or for my patients. So today's 22nd July, 175th podcast is just amazing. Every day, 8 o'clock, we are with some good faculty who is very much doing amazing work in whatever field they are, and they have come with some innovative ideas which will be inspirational to entire country or the globe. This is global platform on which we are podcast. This goes on a YouTube. So Himandu madam, you also circulate this,
Yeah,
after this your own interview to many more people. And Apurva, you always, I still remember, we had your Jumani twice. It was one
Yes.
of the best podcast. I think your topic is also interesting, so people like to hear. So always come out with something novel idea. And I'm thankful to you for getting Madam this time. And we just got associated with each other with Hyderabad declaration. That was a wonderful work. And I found her very much passionate. When first mail came, I never took it seriously because I thought with seven organization coming together doing the work, acha, all the organization are of different like IAP, IMN, her own organization. So I thought it's very difficult to compile all. But she kept on pursuing the WhatsApp group, the mails, and ultimately it all happened in Hyderabad, getting a digital signatures of all on a declaration. I thought this lady is of substance. Thank you. It was lovely meeting you, and we'll
thank you so much.
definitely catch up when I come to Hyderabad or whenever you come to Pune. Thank you.
Sure.
Thank you.
Thank you.
Thank you. Thank you so much, ma'am, for always being there, for always being, your blessings are always with us. And thank you to allowing us to work with the other organization. And, you are always there and with you say, you do something, just involve the other people's, other organization for betterment of women, for betterment of adolescent and betterment of our patients. So thank you so much, ma'am, for always there. And before that, Himabindu, ma'am, I just want to tell you something about the Foxy, about Sunita, madam. And
Yeah,
are actually dedicated for the adolescent. We have a specified committee, the Adolescent Health Committee. We have the committee like Violence Against Women, and who is working regarding adolescent. We have a Sexual Health and STI committee that heading by me. We are working for the adolescent. We have a the Family Welfare Committee, which is dedicated for the adolescent contraceptive. And now, under the leadership of Sunita ma'am has started the Sampurna project. So, what is ma'am? Sampurna project is the nutritional of all the age group from the adolescent to the geriatric. So, ma'am, just I want to emphasis on that, because we are dealing with the anemia, but still we are lacking behind. So, it is the actually the reason behind many time it is due to the adolescent anemia. It is due to the nutrition deficiency in the adolescent. And Sunita ma'am has recognized this, and she started this wonderful project, that Sampurna Aprajita. We have a more than, I think 60, 70, the physical CMEs. I personally have gone to 70s societies across the India, and we are sensitizing our members as well as the society that how the nutrition in the adolescent is so important, because the adolescent tomorrow is actually the adult. When the nutrition of the adolescent is good, definitely when they will be mother tomorrow, definitely the complication regarded with the anemia and etc. will definitely less. So again, this is a brainchild of Sunita ma'am, and thank you so much, ma'am, for bringing out this. Even we are not never think of that why the adolescent anemia and adolescent nutrition is so important. So this is a brief about Sampurna project, which is a flagship of Sunita
Great,
ma'am's
great,
tenure.
Thank you.
great.
Yeah. So now we are coming, and we have Dr. Hema Bindu, ma'am. Just for the audience, ma'am is the professor, unit head at SIG Medical College of Government of the Telangana. Ma'am is the currently the chairperson of AHA India, and recently, ma'am is instrumenting of one of the milestone in the adolescent health, that is the Hyderabad Declaration. And I'm really, really proud that we Foxy are being a part of that, and I'm physically present to witness this historic movement. So now with this initial, we will start our podcast for today. Yeah.
Thank you. Thank you.
Thank
Himavandu
you, ma'am.
madam,
Thank you.
Yeah,
Thank you so much, ma'am.
our protocol
yeah.
is only two of you will have a dialogue and I'll join the viewers link. Okay? See
Okay.
you. See
Thank
you.
you, Sunita ji, for giving an
Thank
opportunity. It
you.
was wonderful, wonderful.
Thank
Looking forward to a great long journey with you. Thank you.
Yes. Thank you.
Yeah,
Thank you. Thank you so much, ma'am. Thank you, ma'am. Thank you. Ma'am, when we
yeah.
are talking about the adolescent, so ma'am, first we are always being a confused which age group is actually we consider is a adolescent. It's always in a matter of debate whether it's a teenage or what's then. So just first question, what actually consistence of the adolescent?
Apurva, a very good evening. Thank you for Foxy for giving an opportunity. It is really a privilege and honor to work with you and along with you, and really look forward for many, many programs together, many such actionable, events together. Now, coming to this common age, what you and we, I'm really excited. I'm so impressed that Foxy is working on adolescents on so many fronts, including nutrition, family care, and you also said the conception, I think unwanted pregnancy, all that we need to cover. Now, coming to this adolescent age group, now adolescent India, that what you mentioned, Adolescent Health Academy, is a subchapter of Indian Academy of Pediatrics, and we deal with 10 to 18 years. So, because that is the definition we are taking, as that is the age group which is a transition between childhood to adulthood. So, 10 to 18 years we are covering. So under the bracket of AHA. So this is our commitment. We have taken this commitment. Pediatricians have taken this commitment long back in 2000 when the chapter was formed. Since then, it's been 25 years. We have been training all pediatricians to take up the whole responsibility to take care of the holistic care of adolescents. Though we have gynecologists, we have other specialists to take care of the adolescents, but for both boys and girls, we at AHA or IAP have taken the commitment to take care the adolescent in a whole, that is nutritional. The growth and development is still continuing. Traditionally, pediatricians, we are, normally we take care of growing up children, right? And the growth doesn't stop at 12. So we decided we'll go up to 18 and even up to 24. Some of the countries are seeing, like American society, they see the pediatric department sees children up to young adults, we say, up to 24, because that is the time when the maturity is happening of the mind, that is the prefrontal cortex. But physically, they mature by 10, 12 years. We know that menarche sets in for the boys also. Another 2 years behind, they also start the puberty signs set in. But physical changes complete, but mental changes or myelination and maturation happens little late. So we are taking the responsibility of this adolescent age group because the growth and development is still continuing, but in a little different way. So that is our age group purview.
Absolutely, absolutely, ma'am. So actually, this is really a confusion question. Even I was always confused what should constitute the adolescent. So definitely, this give a clear message that what age group is coming to the adolescent. So, ma'am, we have a lot of age groups. Like, ma'am, children, we have a child or childhood, then adolescent, then adulthood, then mid age, then geriatric. But ma'am, we always focused basically on adolescent. So, ma'am, why actually this adolescent age group is so important? So we have the national programs is going on adolescent. We have such an organization which are dedicated to that. We Foxy, we IAP, the IMA, everybody has very much concerned with the adolescent. So why this phase is really so important? What make it so important, ma'am?
Apurba, actually, this age group of 10 to 18 years, they constitute 25% of our population. So India has a lot of young people right now. Though we are an old civilization, but we are bursting with young people. That means we have a young bulge. And therefore,
Very much.
we want these young people to be productive. So they should be healthy. So therefore, all of us have to focus on this age group. If you go beyond 18 years, that is up to 24, it is called young adults. So youth, the definition youth is 10 to 24 years. So either you can take up 10 to 18, or we have now extended up to 25 under AHA also. So either 10 to 18 or 10 to 24. This is if you go up to 10 to 24, they constitute more than around 40%, but otherwise they are 25%. So, but still, that's a very huge number. And this age group is extremely important because if you invest in adolescent health, you have three dividends. That is, the immediate generation is, they become more productive because they are going to be immediate adults. And then they can be healthy parents, and the next generation is also healthy. So the adolescents will be healthy, the immediate next adults will be healthy, and their children also will be healthy. So investing on this age group will give really triple dividends to the country. So therefore, all the organizations, UNICEF, WHO, all major organizations are now focusing on this age group, which will give us very good returns. So because we have been investing on newborn health, maternal health, that's okay, that is a need, of course. But the second important age group, I would say, is we should start immediately investing on this adolescent age group because they are going to be immediately uh, productive to the country. So this is extremely important, this age group. And all organizations have to work together because there are huge numbers. There are millions of adolescents are there in our country. Therefore, we have written in this declaration that we will reach out to 1 million adolescents at least by this year end. Let us see how we can work. But we need help of all the organizations who are concerned with this age group. They do have different problems, and we all can come in and pitch in to work for them.
Absolutely, ma'am. Ma'am, this is actually really very important what you have pointed out that they do have their problems, which is actually the different problems. And it can't be, say, their problems are different, their solutions are also different. So, absolutely, ma'am, you have exactly point out very correctly that we should focus on that. So, ma'am, after that, just I want to know from you, as a pediatrician, as a chairperson of AHA, I just want to know from you what are the key factors like education or health? What are the key areas where we should focus on adolescent? Because nowadays you can see, ma'am, the STDs are actually growing, and the social media is there. It again has a positive and negative aspect. So, what are the key aspects in the adolescent well-being?
Yeah, thank you, Apurva. That's a good question. See, we as the children are growing because even pediatricians now are getting rid of infections. We used to see a lot of infections in young children. That is, if we still say below 5 years, the incidence of infections will be very high. But with the vaccinations going on universally, with the general hygiene standards are increasing, I mean, good standards are there. So the infection rate itself is coming down among even younger children. But as the age increases, like 7, 6, 7, 8 years. So they go, the incidence of infections are coming down. They are not more that infections are not very common at that age group, but they have different problems start. Like they may have issues around their puberty. When the puberty sets in around 8, 9 years, the trigger starts and the body changes start happening when you start seeing them around 9, 10 years in girls. So girls start the maturity a little early. So the physical signs you can see quite early in the girls first. So these could be the concerns. So what are the concerns bothering are the young adolescents are the pubertal issues, the body image issues, the secondary sexual characters. If they are very worried, if it is too late, if it's too early, menarche is not coming, or the family, they don't know where to go and ask. So they need to know when to consult the doctor, what is normal, abnormal, what is the normal range. Yeah, and for the boys also, not just for the girls. So pubertal issues can be a concern at that age group. Body image issues, as I said, and there could be issues related to their because mind, they are just maturing. They are that abstract thinking is not yet settled. When we can understand as adults, our thinking, our thought process is different. So we know the consequences of a particular behavior. Like when we say smoking will lead to cancer, we can understand. But for young people, they don't understand. They can't visualize that abstract thinking is not yet developed. So we have issues with the mental makeup also. So we need to appeal to them concrete. The concrete thinking is there, so they can only see what is immediately effective. We can tell them the same message in an appealing way. So we can tell them, see, if you smoke, your lips will become dark. Your friends may not like it. You start smelling. Those are more. They are more worried about their body image rather than cancer at that age. So we need to give those appealing messages because we understand the physiology of adolescence. So the mind is still growing, the thought process is not yet matured, so they can have concerns with their the life skills are also not there. So like when to say no, and they can, because the changes are the physiology during adolescence is they are the hormones are kicking, they are the
Yes, ma'am.
testosterone, estrogen, these are the sex hormones. So they are in search of hormones that time. So they start getting curious, they explore the world, they experiment with their bodies, they also want to have fun, they have high risk behavior. So they explore with smoking, drinking. That is the toughest time. Most of the adolescents, if you ask any person, where the first sip or the first smoke happens usually during that age, either due to peer pressure or just want to explore. So these are the various issues at that age. So it's no more infections. It is basically the body image issues, pubertal issues, high risk behavior. In that high risk behavior, we also have sexual experimentation, STIs, including HIV and unwanted pregnancy. So they may not know the consequence of physical intimacy or intercourse, that it may lead to pregnancy. They may not know that. The knowledge is not there. So they don't have comprehensive sexuality knowledge. They don't know but the body parts themselves. They only see external. They don't know the internal body parts. They may not know the consequence of even intercourse. So these are the things I think we should at that age provide knowledge, a comprehensive knowledge about all these aspects, and also give them life skills, because life skills are the brakes in life for them. Like they are like a speeding car without brakes. They love to have thrills in life, but they don't have brakes. So this car can fall into problems. So we need to give them life skills which are breaks. Life skills are nothing but self-awareness, like decision making, coping up with various emotions, including suicidal tendencies, mental issues, all that they have to learn to cope up with those low moods. And these are very common. Mental issues are also very, very common among adolescents. So these are the few important issues, but the new problems are also developed like digital. They are so addicted with digital media, and that's another disease. We are now metabolic issues, junk foods. So these are the issues we are it is now raising concern about it, and we came out with a nice module this year which encompasses these four aspects. I just want to end here saying that four aspects of adolescent health, which we are calling a call for action to empower Yuva on youth wellness. That is on sexual wellness. Then we have metabolic wellness, digital wellness, and mental wellness. So, and a little bit of vaccination we are telling them. So, we are driving these 5 points through our action plans this year. Thank you.
Great. Great. It's a really, ma'am, it's really amazing work which you are doing, and you have bringing out these four very, very important points about the digital, about the metabolic, because I think these are the main thing nowadays. The yuvas or the adolescent are actually the fighting among them, because they are really body disfigurement, metabolic problems due to metabolism, the adolescent diabetes and other health concerns are also there. The sexual problems are there. Absolutely, ma'am. It's really it's a wonderful initiative. And ma'am, just after when you are focusing on these aspects of the adolescent, just I want to know, as a healthcare provider, whether might be any of, like, might be family medicine, might be pediatrician or gynecologist or anybody, what is our role as a healthcare provider to give them optimum, the health and well-being of the adolescent? What's the our role? And similarly, ma'am, according to you, what's you are thinking that what should a parents and as well as the teachers, because I think they are the one who are closely associated with them, the adolescent, and they are seeing them growing. So what's the role of the teachers as well as, ma'am, the parents? First, ma'am,
Yeah.
healthcare provider. Yeah.
Yeah, Purva, that's three action points which you asked me. The role of organizations or doctors like us, then role of parents and role of teachers. Now, I would like to first say we have to understand adolescents first. They don't walk in to our clinics saying that I have a problem. Their health seeking behavior is a little bit different. They are shy and they always feel the adults are judging them. कि भाई ये wrong कैसे पूछ रहा है, what questions is asking. They feel that adults don't understand them. They make fun of them. They don't have trust in the adults, and therefore they hesitate to come to the any of this either doctors or parents or teachers, because all of us sometimes become judgmental. So the first thing I would say, as Adolescent Health Academy, we are stressing that all the caretakers who we want to care for them, right? We all want to care for them, but we need to understand their physiology. They don't trust. They require privacy. They want the key. Our centers, our clinics, or our places are spaces for youth. We want to create spaces for them. Ki bhai, you come and please, we are there for you. But they will come in only if you ensure privacy, confidentiality, and non-judgmental attitude. And you should be friendly, of course. So only then they can open up with you. So being non-judgmental is extremely important. That is, you are brought up with certain culture. You cannot blame that array character on somebody's. You can't judge anybody by just their acts. So you should first ensure that. So I think it applies for both parents, teachers, and all healthcare providers. ये पहले होना चाहिए. Then only our success roads rate will be more. Then slowly it takes time. Then if you just advertise that I'm there for you and this is what the services I'm going to give you, first is good listening skills. You have to have a lot of patience and you have to break the ice with them. So you can just speak to them in a very friendly way, and they should have confidence that he's very friendly, should come down to their level. And then there should be like an open, counseling skills. We should not have any barriers. And it should be like, okay, I'm there for you, I'm there to help you. So when we just, maybe in the first session will not break the ice, but slowly if you just give them information that you will keep it confidential and privacy will be ensured, and they can open up with you, you can give solutions to them. And in fact, in the pediatrics, we normally give importance to the guardian, that parents. Child को हम देखते हैं, but उनको we don't take consent from the child. But for adolescents, we are training our pediatricians that now this adolescent is an individual. You have to respect him, take assent and consent both from the child and the adult, that is guardian. You also give them separate time. So we pediatrics have only focused on the parents से ही बात करते थे पहले. Now in the adolescent care, we made it that mandatorily this child has to have our time. So we tell the parents to please go sit outside and we talk to the adolescents in privacy. And we only inform the parent only if it is life threatening. That is when there's a suicide, sexual abuse, or something like a substance which is very, very life threatening. Otherwise, all like small love affairs or one experiment with a cigarette, all those things we are not going to talk to the parents. So these are few things we train. And psychosocial history taking. This we train our pediatricians how to make the adolescent open up. We ask some open-ended questions regarding their home environment, their school environment, and how they feel safe or not, what is happening with their scholastic, and with how many rapport with the parents, friends, what is their goals in life, do they have goals in life, and then try to understand their hobbies, how do they stress bust, how do they, what things they do when they want to de-stress, and we try to understand their strengths and weaknesses and work on that. So there are a few tips. Same tips apply, when we tell parents, by all the parents and caretakers, all of us, we have to first understand them, how to approach them, modify our behavior, be non-judgmental, and teachers also should be told about certain screening things. Like at least unko ye bata do, when to refer to the doctor. When they are too short, like physical issues, short stature, or not attain menarche up to 16 years, 15 years, and maybe look area, you should know what is normal, abnormal discharge, when to report, and if suppose there is a mental low mood for more than 15 days, that's enough to say it is depression nowadays, as per our latest definition. So we have to tell the teachers and the parents to identify these red flag signs. If you see your adolescent not interested in the surroundings, not taking food or overeating, or sleeping too much and not socializing, this is highly important because we see the increased incidence of suicides among adolescents. So they are silent and we don't even identify. So mental well-being ke liye, then physical well-being, and these are the we have to give them red flags and even substance abuse. So when to identify nicotine, alcohol, and other drugs, hard drugs, we have to give them red flag signs. Both the parents and the teachers have to be educated, and we as doctors, we have to be a little adolescent friendly and non-judgmental, and have your services open for all this. So you may not be expert in mental issues, but you can definitely, as pediatricians, we are training all our non-AHA IAPNs on mental well-being, at least a screening aspect. And if we want, we can always do a cross consultation. Therefore, adolescent health is actually teamwork. We need a gynecologist, we need a psychiatrist on board. We also will require a psychologist or somebody, a counselor. So we can have these people on board. And acne and other issues also there during this age. Body, they're very conscious about their face and how they look. So we do get them. We don't should not make fun of them. We say, yeah, I can understand. This is really disturbing you. So how can I help you? So first validate the feelings. Make them feel that yes, doctor is trying to. Yeah, he's the one who's understanding me. So he'll open up with you. Acne and dandruff, these are the issues. So we can. So we need to be empowered with all these common issues which adolescents have, and we can give them basic treatment and cross referrals if we require, second opinion if needed.
Absolutely, ma'am. So, so many time, what I feel that the adolescents are coming with us like a gynecologist, as you said, ma'am, some discharge, some infection, or like some periods, irregular period. So I think that is the best time when we can counsel also them regarding their well-being. This is the perfect time because many time, they are be very shy and they will not come with you and not open up with you. Ma'am, you have very rightly point out that yes, we as a healthcare provider is really very, we have to be very passionate about trying to listen from their problem. Probably in the first time,
I
in the
just want
first
to
grade,
add
they
here,
will be,
Apurva.
yes.
Yeah,
Huh.
I just want to add because parents sometimes they're not so very communicative regarding their sexuality and other issues. So there's a distance developed, between the parents and teachers because there are some other traditional role. But teachers only for academics, they don't enter into this other things about the what's happening in the adolescent's life. Even the parents, they're stressing only on academics, marks, and क्यों तुम उस कॉलेज भेजा पढ़ाई करो और कुछ नहीं बात करना है. But that time they are so diverted with so many feelings. They may have love affairs, they may have cross gender, same gender attractions. They may be so bothered about other things, which may be impacting their school performance also. But teachers and parents are only bothered about academics. So therefore, we need to tell them if you want your child to do well in academics, open up and talk to them. So the communication channel should be open right from the beginning in the family, so that the child is comfortable talking about this at home itself. Otherwise, they will go through internet or through friends, and they may resort to may not be a good options for them, but a better a scientific body like us at least help them. Both IAP or whether it is Foxy, we can do a lot for them. Yeah.
Absolutely. Absolutely, ma'am. Absolutely. You're very correctly said. And I think, ma'am, because I am the part of that, I witnesses the Hyderabad Declaration. I think me, when I go through that, what is Hyderabad Declaration, the amount of effort you have put to publish and to, you getting all the seven organizations together. And it is, I think it's a milestone in our country towards the adolescent health and well-being. So, ma'am, just I want to ask you, just please for our audience, you just tell ki what is that Hyderabad declaration is and why there is a need of some this type of declaration to have in reality. So, ma'am, can you just enlighten us what is this? Yeah.
Purva, this is an effort. Basically, when I took over as the chairperson of Adolescent Health Academy, and it's been a 25th year. So we really wanted to leave a very strong footprints in this year in terms of adolescent health. So I was looking at, one dedicated day should be there for young people. Why not? Just like antenatal cases, government is looking. We do a lot of activity around 9th of every month for ANC cases, right? So why not for this young people? After all, they are 25% of our population, and we do not have a dedicated day,
Yes.
neither
Yeah.
any clinics for them. No centers are there which are very active. Yes, there are guidelines under RKSK. Government is doing a lot, and they've opened up some spaces and some government, PHCs and all that. But it is not catching up well. I think we have to relook at as those centers and do a gap analysis. But I thought we should do something around 18th of every month. So 18th is a time when the, 18 साल का पहले बोलते थे ना 16 साल was very we see in the movies and all that 16 बरस का it's celebrated.
16 बरस के
18th is yeah. So 18 is something I think where I ask some young people, they always look forward when they'll become an adult. And legally in India 18 years के बाद उनको voting license मिलता है and license भी मिलता है driving license, voting rights मिलते हैं. So they all look forward कि मैं बड़ा हो गया, and they can open up their bank accounts, they can do anything. So they are like an adult. So 18 years should be celebrated. And therefore, I said, I picked up that
Oh,
18 as a youth wellness day. So let us make it more like instead of sickness, let it be wellness. Let there be positive vibrations and let us educate our young people, empower them about all the wellnesses, sexual wellness, metabolic, all that what I said, mental, etc. And give them the whole knowledge and awareness to seek help. If they are not metabolically well, पहले उनको पता होना चाहिए that their body weight is important. BMI करा लो, screen करा लो, and they can go for help if the BMI is deranged. So they need to know what is metabolic wellness first. Then because the incidence of metabolic issues are rising as you mentioned. Then what about sexual? Oh, lot of things. It is a very this topic we don't talk about much, but India luckily we're opening up. And if all 6, 7 organizations start talking about it, it will become a wave and a movement. So when we started calling this wave 18, a wave is well empowered, vibrant and this thing youth. So that is the outcome we are looking at. And 18th of every month we want to celebrate the Youth Wellness Day, and we want to celebrate not just within pediatricians. We want gynecologists to, and even the IMA organization, which is the mother organization of all the organizations. They have lakhs of doctors under the umbrella. Why not all of us care for them? At least that one dedicated day, talk about some common issues which are concerned for the youth and how we can roll out in the community, do some community awareness activity, lead an advocacy campaign, do something for adolescents. We also have themes every month. So like the last month we did sexual reproductive health. So then we may have different themes every month and we work around that. So that is the idea, that one dedicated day we are declaring in the Hyderabad declaration, that we want one dedicated day for the adolescents and young people, and all 7 organizations we commit and we promise that we'll do something for the young people on that particular day. And we are looking at escalating this so that the ministry also joins us, the WHO and the ministry. So that will be a great landmark. And the second thing is we want to open up Yuva clinics. So that is what we declared, that we'll be trying to open up spaces for adolescents. So this is important. And one more thing I want to mention about preconception care, Apurva, where Foxy and we can do much more. So we have published guidelines, myself and a team. We have published guidelines on preconception care. That also can come up in a big way on in India, because young people really want to know before they conceive. Just now I heard Madam Sunita saying that we don't want unwanted pregnancy at all. Every pregnancy has to be planned. So why not? Yes, with preconception care, more planning. Have a good planning, prepare yourself before you conceive. So these guidelines are also there. We can do a lot about empowering youth about preconception. Few gist of what the Hyderabad Declaration is all about. And I hope we can reach out to 1 million. That is the promise we have done in the declaration. So we have to reach out to 1 million adolescents shortly. Thank you.
Ma'am, definitely it's a milestone, and when we start, so it's like na अकेले चले थे हम लोग मिलते गए और कारवा बनता चला गया. So it's like
बिल्कुल.
that only. So Matt, definitely a landmark, and it's give a spark to everyone. Yes, there is a day. For example, ma'am, you have mentioned 9th of for the ANC Day. It's a Pradhan Mantri Swasth Nari Yojana. So, ma'am, that was a day which is celebrated everywhere. And even the private clinics, we have going to start that, and we are giving the free consultation that day. We are giving the free hemoglobin checkup and etc. for that day. So definitely, ma'am, when we start something, it's definitely make a momentum, and it will be benefit to our adolescents. So absolutely, ma'am, it's very important. So, ma'am, one more thing that whenever I was there, and when I saw the first time the declaration, I have just see that you have included 8 organization along with that. So, and why you are thinking? I know it's always better to collaborate every organization, but as an adolescent, you can do your by your own self also. Okay, but why you just incorporate the 7 organization, including the Foxy? What's your the mind behind that? Why you? What's the thinking behind that, ma'am? Just I want to ask you.
Nice question, Apurva. I think, see, we are 3,700 adolescent physicians, and IAP has around 47,000 members, pediatricians. So, even if we are continuously training our pediatricians on how to handle adolescents. Like I told you, we have modules on even how to counsel adolescents, how to deal with adolescents, being adolescent friendly, how to do history taking, how to examine. We are not going to be intrusive. Even STI clinics, when we go to, when we handle adolescents, we tell them, just take symptomatic symptoms. Based on symptoms, we give management, treatment. We don't tell them to undress and even examine. So there are certain do's and don'ts. We're training day in and day out our pediatricians. But I don't think हम काफी हैं. हम 47,000 members के साथ, you can see how many millions, 2.5 million adolescents are there in our country. So इतने adolescents को reach करना है, तो I think we all have to join hands. मुझे सबका help चाहिए. AH is requesting help from IAP and us, and then of course we went beyond Foxy, because adolescents come to you also, right? And especially girls, they all come to you, and but they may not open up. They may. We also heard that they feel shy. They don't want to wait in the line among pregnant women. Okay, they want some special without waiting. They feel shy to wait in that queue. So little spaces have to be modified when we have to help them. But otherwise, gynecologists are a great resource for us, because they are there for caring for those girls. Of course, till 10, 12, they come to us. After that, for missed periods or some other problems, they come to the gynecologist. And they also working. You also have a committee, right? You mentioned that you have a separate adolescent committee, you have a separate STI committee. So you also are working for adolescents. And therefore, if we all join hands, this collaboration will definitely be more impactful. We also wanted IMA. Why not a common MBBS doctor can also think about it?
Yeah,
Why not all
absolutely.
organizations, right? So because we are looking at even prevent to promote to health only. We are not even looking at only screening. We can even empower them about basics, about how to screen, about कहाँ पे refer, what is normal, abnormal. That's all. Regarding all aspects of adult health, we can come out with a small capsule, and we can, all of us across all doctors can be empowered. IMA is a huge force, and I want the preventive social medicine, all the other organizations who can help us. So I'm so happy that immediately once we started talking about it, within hours we got the consent of all organizations. Thanks a lot. That was really a very, very important landmark event for us. And we are also equally excited that this has happened. And we're looking forward for meaningful, engaging work ahead with all organizations. I think collaboration really works. Let us see. It works wonders because the burden is huge and we require many hands.
Many hands. Absolutely, ma'am. It's you have very correctly said that burden is used, and definitely jitne haath honge, ma'am, it will be more beneficial, and definitely our goal, our aim is to benefit our adolescent. So absolutely, ma'am, and it's a very wonderful and very great initiative, and I must congratulate you to bring out and thinking of this, ma'am. Thank you so much, ma'am. So before we end, ma'am, because I just you have explained about the comprehensive sexuality education, because I am the chairperson of the Sexual Health and STI committee. And but the IMA is also working on that. Even I am also part of the IAP when the
Yeah,
modules were about to there. I was part. I have attended meetings, the Zoom meetings of the IMA. So, ma'am, just I want to tell you because as a gynecologist, we are no. But many times we are getting the oppose from the society that why you are to the children you are giving that sexual comprehensive sexuality education. So ma'am, just I want to know from you why it is so important to have the sexuality education for the adolescent. So why it is so
yeah.
important? Yeah.
Yeah, thank you, Purba. We all had resistance. Even IAP has tried to introduce sexuality education long back. And I also, I did a lot of field work and I was in the community, even training teachers, went to schools, colleges, but I definitely, or many of us had this resistance. Even the government has discussed it. In some states, there was so much of resistance, we had to stop the comprehensive sexuality education. But there is some headway and it has come already in the curriculum in the schools, right? But the reproductive system, I really wonder why we have so much shyness around this system. I introduced this, the way I approach to the religious bodies or to the teacher forum or to the parents forum, because the resistance comes which usually from them. कि what is the need? So I just really introduce them. See, we all have this body parts right from the beginning, right? It's not that it came suddenly at 10, 11, 12 years. How do you know you're a boy and a girl? It is because you were announced as a boy and a girl depending on your external genitalia. I think newborn baby doesn't have anything on the face to tell the sex of the
Yes.
baby, right? It's only when you look at the bottom, you are announced by some nurse or the doctor, ये लड़का है, लड़की है, right? वो तो facts of
Definitely.
life है. उसके बाद में we just cover their external genitalia, कोई बात ही नहीं करता उसके बारे में. Then we start talking to them the parts of the body. We always tell our children कि अभी क्या बोलते हैं? So we smell with our nose, we listen with our ears. But with that, Susu, what to do? When the child is asking us, we say, shh, baat nahi karna hai. So, we start again covering up. The child's curiosity stays. जितना हम cover करेंगे उतना वो पूछता जाएगा. If you say shut up, then they will go to some other source. So curiosity will always be there, and it is better to tell age appropriate information. So that's how I bring in I don't call it comprehensive sexuality education. I just talk to them about body parts. I just tell them, please tell the functions of the body parts, because we are teaching them about heart, descending aorta, ascending aorta, parts of the so many parts of ventricles. We are telling so much at every system. बट रिप्रोडक्टिव सिस्टम के बारे में ज्यादा कोई डिस्कशन ही नहीं होता है. दे डोंट नो कि ओवरीज है उनके पास गर्ल्स को. वी ओनली टेल देम अबाउट मेंस्ट्रुअल साइकिल एंड मेंस्ट्रुअल hygiene, but we need to tell them that ovaries ovulate, eggs are coming, that you can become pregnant. This is the basic. We don't tell them, we don't tell them at all, you know. So there we don't have a comprehensive knowledge. नहीं बता रहे, we only in parts में बताते हैं कि सेंस हाँ बड़ी होगी बेटा, अभी तो तुमको पीरियड्स आ गए हैं, तो ऐसा करो बैठो, you have to do this, you have to do that. So the myths are also there around sexuality and reproductive system. So all that, I think, as scientific, we are the right, all the organization doctors. So we will not have much resistance if we talk about science. They start with body parts, hygiene, and then say age appropriate information. If the boy should know that urinate and the seminal fluid come from the same organ. Girls should know the menstrual fluid of the baby comes from this vagina. Start using these words, testis, vagina. The society should little get, used to it. And you have to, this is important. The girls are not knowing that they can become pregnant. And we don't tell them how the eggs are fertilized. कि जैसे मेंस्ट्रुअल फ्लूइड आता है, जब एग नहीं फर्टिलाइज होता है, यू गेट मेंस्ट्रुएशन, एग फर्टिलाइज होता है तो प्रेगनेंसी हो जाती है. कैसे होती है? देन मैंने आस्क दिस क्वेश्चंस इन द ऑडियंस, इवन डॉक्टर्स हेजिटेट टू आंसर. हमें तब तुम, व्हेन यू चिल्ड्रन मस्ट बी आस्किंग यू दिस क्वेश्चंस ना, कि मैं कैसे आ गया दुनिया में. सो व्हाट डू यू आंसर? कि भगवान ने दे दिया, स्टमक से आ गया, ऑल दोस थिंग्स. सो व्हाई नॉट जस्ट टेल देम कि यस, age appropriate. So when they start asking questions, that means they're ready for listening. And otherwise pornography, या they may exchange CDs, कहीं ना कहीं तो कुछ ना कुछ wrong information भी मिल सकता है. So better to say that yes, hormones are kicking in, the boys may get excited, then the pineal gland when excited can become stiff, and when physical intimacy happens due to attractions, the intercourse happens, that is the pineal gland goes, penis goes inside the vagina, and then the seminal fluid is released, and this seminal fluid में sperms होते हैं. Sperms goes and meets the ovum, and that's how embryo is formed, or the fertilization happens. Then this embryo is actually sitting in your uterus. Show them the internal body, show the pictures at least. See, this is the uterus. Now baby is being nurtured till 9 months. Then baby comes out after maturity from the vagina. Simple, just finish. The whole thing is over. Otherwise, like Indian stories and films, we show two flowers doing like this, then some
Yes, ma'am.
birds are chirping. No, we hide certain. We are the real romantic society. So many songs are there around romance. Khajurahos and Konarks are there in India. Somehow we are still struggling talking about sexuality. So comprehensive sexuality ke badle, if you have that problem, start with family life education. We use some other terms also, and say that like family, we start talking. Your brother looks different. You look different. Why are you different? Body parts ke bare mein bolte hain. They see in the family itself, and then they say this boy will become like your father. So in the family, there's a father, there's a young brother, there's a mother, there's a young girl. So you can see everything is in the family. So you can start talking to them in that way, family life education. And we say that okay, by 10 to 12 years you get this pubertal changes, but beta, we don't want you to take those decisions, or when the feelings come, cope up with them. We also have to tell them क्या नहीं करना है बोलते हैं. No physical, अरे बिल्कुल बिल्कुल गंदी. We tell them, but tell them what to do if they get those feelings. Coping up with emotions, how can divert. Sports is a very good activity. So we pediatricians advise sports and distractions. Sports is a very good activity. We also have to tell law of the land. Till 18 years, even with or without consent, both it comes under crime under Fogsi Act if there's a sex with even with consent. So that law of the land भी बताना है उनको. So they cannot have sex till 18 years. After 18, we are not talking about marriage and other things, but we're not even promoting that. We still say abstinence and wait, and you say that okay, if you're becoming sexually active, at least be safe. We talk about even safe
Yes,
sexual behavior, condoms, contraception. सब बोलना है, information तो देना है.
absolutely.
In fact,
Absolutely.
studies have said if ज़्यादा ये सब information देने से there's there's a postponement of sexual activity, or it doesn't increase. The parents need not get worried. We can give them scientific evidence that when we give this knowledge, there's a postponement of activity and less incidence of unwanted pregnancies and STIs. So we have to empower them with knowledge. I think by now we have all have accepted it, and we started taking this in the mission in the IHS, doing it through these programs. We all request you to join us in this mission also.
Absolutely, absolutely, ma'am. And it was so brilliant and it's just so exciting, ma'am, that you have used the word, probably the words comprehensive sexuality education should not only you should have a particular topic. The main purpose of giving knowledge to them, the knowledge may be in any form, in anything. Maybe you call it as sexuality education, maybe you call it as a good touch, bad touch, or maybe you call it
Yes.
as a, the
Actually,
body disfigurement,
Apurva,
or yeah,
actually,
yeah.
yeah. Yeah, Apurva,
Huh.
good touch, bad touch, we started teaching the young children right from 3 years. Because
3 years,
pediatricians know, we say, gender ka pata chalta hai. The girls and boys know they're girl and boy by 3 years,
three
right?
years,
So
yes.
we started talking about good touch, bad touch by 18 months only. We start
Oh,
telling them कि about good touch, schools में भी पढ़ाया जा रहा है आजकल. So good touch bad touch के बारे में बच्चों को बहुत पहले से हम सिखाने लगे हैं. So वहीं से we can start talking, and if we have to have a बहाना to start talking about it. कुछ advertisement आ गया, कुछ भी हो गया टीवी घर में, Even if the parents can pick up this topic for discussion in a very friendly way. So there should not be silence around these topics. So we need to drive this around wherever is possible. Extremely needed now because a lot of STIs, HIV, unwanted pregnancy. Why should we have all this when it is preventable? Right? With little knowledge and safe sexual behavior, we can prevent all this. And the most important, let us adolescents need not feel guilty about it. अगर कुछ हो गया ना, फिर भी we can say we are there to help you. We are not promoting it, but at least don't make them feel guilty about it. We have to help the adolescents unconditionally, whatever status they are, in whichever situation they are. So that is our goal of AHA and IAP. So we request you all to join hands with us. A lot of work is there for us ahead, at least especially in the sexuality education.
Absolutely, ma'am. Thank you. Thank you so much, ma'am. And ma'am, just I also want to inform you as well as the all the audience that we also work in on this the comprehensive sexuality educations, and luckily we are able to form the 4 modules of that. And you all know that 4th of September every year is celebrated as a World Sexual Health Day. So 6th of this year we have a conference at Ahmedabad, and from the hand of our respected Dr. Sunita Tandulwadkar madam, we are going to release those modules. These modules, the purpose of this module is it is absolutely the age appropriated, the society appropriated. It took almost 2 years to complete these modules. And ma'am, the basic purpose of this that now we have a strong 286 Foxy societies. So we will give this module to each and every one, every president and secretary. We give a Zoom talk and give a master class series to them, and they will teach in their societies, respective societies. And whosoever want to volunteer from that particular society, they can and they can go to the high school and colleges and give this sexuality education. So without that, ma'am, a person who is sitting in the Kanyakumari can be trained and they can be volunteer of that. A person who is sitting in the Baramulla in Jammu Kashmir, they can also use that. So this is the basic thing behind this whole purpose, ma'am. And we are absolutely
Yeah,
coming with this in the month of September. And
thank
definitely we
you,
also want
Apurva.
to associate it with you. Yeah, ma'am.
6th of September, right? 6th of
Ma'am,
September or 6th of
6th of September.
6th of
Yes, ma'am. 6th,
okay,
because
yeah.
4th is
Uh,
actually it's the World Sexual Health
Sexual
Day,
day, yeah.
but actually our conference
We'll
is on 6th, so we will release it is on 6th.
Right,
Yes,
thank
ma'am.
you. And
So
actually,
that,
in
and
we
of
also are
course,
having
ma'am.
a
Yeah.
National Adolescent Conference in same in Ahmedabad in September last week, and we are also will be releasing
Oh,
that through our national conference in Ahmedabad. And I think that's great
wow.
that all the organizations have come together to form consensus about this sexuality topic, so that you and me speak the
Absolutely,
same language
absolutely,
across the
absolutely.
country. So
Same
that is a
language.
great initiative we all have done together, and from such great scientific bodies like Foxy, IAP, HA. So we're all going, these modules are going to be extremely important for us to roll out this program throughout the country. Right? Yeah. Um, Apurva? Apurva?
No, I think net is cut. I'm
Yeah,
just
there's
just
some,
one. Yeah, we just went on Fogsi.
yeah. Yeah, Apurva, we missed you in between. Yeah. Dr. Apurva.
Yes, ma'am. I think there is some technical problem. Yes.
Yeah, yeah,
So
yeah.
sorry for the interruption. So this will be absolutely, ma'am. It's a wonderful discussion, and it will definitely we have touched if and every or different aspects of the adolescent. And I think in the month of September we are coming with the consciousness of the comprehensive sexuality education. Definitely, it will be also a milestones toward the adolescent health as like the Hyderabad Declaration. So thank you so much, ma'am. Thank you so much for giving your
Thank you.
precious time, for your valuable ideas and your thoughts. It's really a eye opener and give a take home message to each and every one of us. Thank you so much, ma'am. And in the future
Thank you,
also,
Apurva.
we Foxy will be associated with you for the development and betterment of the adolescent health.
Yeah, thank you so much for that commitment. I am also looking forward for working with Foxy, especially with you and Sunita madam. I really thank all of you for joining hands with us and really looking forward for a great, great year ahead. Thank you.
Thank you. Thank you so much, ma'am. Thank you so much. And at the outset, again, I will thanks to our very, very dynamic Dr. Sunita ma'am for always being there, for always for her blessings and for always being there, even in her busy schedule. So thank you and thank you so much, technical team, for always being so active and so fascinating about this. So thank you so much, and thank you so much to all the audience. Thank you.
Thank you and namaskar. Thank you.